Hello, welcome to the Board of Health meeting of March 1st, 2021. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 38, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number posted, 1-508-945-4410, and the meeting ID number is 444-507-252#. Despite our best efforts, if we are not able to provide for real-time access, we will post a record of this meeting on the town's website as soon as possible. And also just ask anybody to please mute their microphones when they're not speaking. And if you're on the phone, you can use *6 to mute and unmute your phone. And now I will turn this meeting over to our board chairman, John Beckley.
Thank you, Judy. I'd like to start the meeting today by establishing a quorum of the Board of Health members. So when I call your name, please indicate whether you're on the call. Dr. Noble Hanson.
Present.
Ron Broman.
Here.
Ed Sheehan.
Here.
Okay, Ed, good. Carol Boyce.
Here.
And John Beckley, myself. So, okay, we've got all 5 Board of Health members on the call. And we also have 2 alternates, Dr. Alan Ward. Alan?
Right.
And Dr. Richard Edwards. Dr. Edwards?
Here.
So we have a wonderful turnout tonight. Tonight's agenda only includes 2 hearings plus our regular update on COVID-19. So let's start with the first of the 2 hearings, which is a variance hearing for Scott McDonald at 108 Forest Beach Road Extension. And J.M. O'Reilly and Associates is representing the application. John O'Reilly, you on the call?
I am, Mr. Chairman. John O'Reilly here for the McDonald's.
Okay.
Can you hear me okay?
Yes, I can. Why don't you introduce the application to us?
Sure. The McDonald's are looking to upgrade an existing failing cesspool that currently serves the 4-bedroom dwelling on the corner of Forest Beach Road Extension and Pellet Lane. We have positioned the septic system so as to maximize all appropriate setbacks, which leaves us with 1 variance we are requesting the board to allow, and that is a setback of the leaching facility to the western property line, and we're asking for we're holding 4 feet and we're asking for 6.
Okay.
There is no expansion of use. It's really just an upgrade of a failing system.
Okay. Thank you, John.
Thank you.
We have a recommendation from Judy to the board members that we approve this application. But let me first ask any Board of Health members who have any questions or comments on the application to express them now.
This is Noble. Yeah, I was wondering, how did the cesspool fail? Did the property transfer, or was it another problem, or a voluntary inspection? Or?
No, they have owned the property for some time, and they have been nursing the cesspool along, pumping it a couple times a year, and with the hope of getting onto the sewer, but they really don't want to go through another summer of pumping it. So that's why they're doing this. It's not a sale, it's not an addition or anything. It's just that they've nursed it as far as they can, and now they just like to take the bite out of the apple and upgrade.
Yeah, and then, so it's a 4-bedroom, I drove by, it's quite a small lot. So it's a grandfathered 4-bedroom officially on the town record, is that it?
I don't know what the assessors has it listed as, but there are 4 bedrooms in the home now.
Yeah, Noble, this is Judy. We go by the floor plan that's presented to us. I did not double check the assessor's record, but I can try and do that while we're discussing it if you'd like.
Yeah, I mean, I'm just,
The
usually,
assessor's records and our records aren't always lined up because sometimes we call something a bedroom that they don't.
right, so, but they're requesting a 4-bedroom,
Right.
Title V septic.
So Judy,
So I guess does it make a difference? Yeah, it does, what the house is actually now.
Well, they're saying it's the existing 4. They're showing us a floor plan for an existing 4, 2 up and 2 down.
but Judy, is it important that the town records reflect that?
Usually what I do is I let them know after the fact, what we consider it. If there's any question as to the bedrooms, sometimes I will do a site visit where I'll actually walk through the house. I did not do that on this.
But do you know what the town records reflect?
I can check if you want to give me a second.
Oh, you could do it right now?
Yeah, I just have to go online.
Yeah,
Okay.
this is Noble. I mean, obviously, I'd have no objection to the Title V septic. That would be preferable. It's just a matter of how many bedrooms it would be allowed by the rules.
And the tax assessor data should reflect what is. In terms of tax assessment.
Right.
Is this just used as a summer residence, Ron Broman?
They're down here quite frequently, but it's their second home.
Thank you.
Hey, John, it's Bob.
Yes, Bob.
Yeah, the assessors have it listed as 4 bedrooms.
Yep, I just came up with it. Yes, thank you, Bob.
Thank you, Bob.
Thank you,
Well, this is clearly an environmental enhancement and an improvement. I'm glad they're doing it, so I'm perfectly fine with it. Can I get a motion from a board member to approve?
Ed Sheehan, approve.
How
I
about a
spent
second?
couple of days over there with those guys. Try to wiggle everything around. Doing very well.
All right, can I get a second?
Noble,
I'll second
second.
it, Ron Broman.
Noble, okay. Any further comments from board members? If not, anybody from the public wish to comment before the board votes on this motion? Okay, not hearing any.
John, would you like me to read the conditions?
Yes, thank you. Thank you for that. Judy, please read the 4 conditions.
Yeah, the applicant should restrict this property to a maximum of 4 bedrooms and record the restriction on the deed at the Barnstable County Register of Deeds and submit a copy of the executed deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. The applicant agrees to abide. Oh, I'm sorry. There's only 3 conditions. There's no Conservation Commission issues on this, so I'm going to cross that out. No alteration to the floor plan of the dwelling will be allowed without further review by the board or its agent. That's it.
Okay, thank you, Judy. Let's proceed with the vote on the motion now. When I call your name, please indicate how you vote. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
and I vote John Beckley to approve as well. So the motion carries and the variance is granted. All right, good.
Thank you.
You're good.
Thank you very
Good.
much. You'll have a good night.
Thank you.
Thank you, John. You're very, very welcome. All right, let's go to hearing item number 2, which is a variance hearing and approval of IA Technology for Dawn Drinkwater at 60 Ridgevale Road, and representing this application is Clark Engineering. And I know David Clark, you're on the call, David?
Yes, I am. Good afternoon, David Clark, Clark Engineering on behalf of Mr. Drinkwater. This lot used to have a house on it, actually used to have a house and a cottage on it. Just before it sold, they upgraded to Title V with a 5-bedroom septic system. Then the house and the cottage were torn down and the lot divided. So there still exists a 5-bedroom Title V system designed under the 1995 code, but I don't think it's ever been used. So what Mr. Drinkwater is proposing is to build a 3-bedroom house. If you look at the floor plans, it is a modular house, and the second floor is being shipped unfinished. So the house will be erected on the site, and then Mr. Drinkwater will be pulling out a building permit to finish the second floor. And you see the outline of the second bedroom and the home office. The home office will be it meets the definition of a bedroom under your regulations. So we have to give up the existing septic tank and replace it with a singular tank, and the 3 trenches is an over-design per code, so we only need 2 of the 3 trenches, so 1 trench will be abandoned in place. As always, a 3-bedroom system with treatment introduces less nitrogen than a 2-bedroom system without. I'd be happy to answer any questions.
Okay, David, thank you. At least that clarifies the 5 and the 3s that I was getting confused about in Judy's memo. Okay, so again, this looks fairly straightforward. Questions or comments from board members to the applicant?
Yeah, this is Noble. I guess I have a question maybe for Judy or the applicant, I don't know, but so you're going to use the existing leaching trenches. Do they need to be inspected, or what's the rule about that? How do we know that they're functioning right, or do we assume that because of the age?
We have to uncover the ends to repipe a new distribution box, because the singular system requires a larger distribution box. It acts as a recirculation chamber. So we might have to go back to the ends of the trenches. Again, this has not been used in probably 20 years at least, if it was used at all. I think the system went in 96 or something like that, or 97. And the cottages, I think, were torn down soon after that. So I don't see that an inspection is going to reveal anything, because there hasn't been any standing effluent in this for at least 20 years, if ever.
So this is Noble. So Judy, there's no rule or regulation about that. What David said is the way it'll be.
Yeah, I mean, I think during installation, what David said is true. We would want to hook the new D-box up and make sure that it's running it's a gravity flow through the D-box to the trenches, make sure everything is running well. David would have to make sure the trenches are at the proper, elevation with everything. There aren't any real groundwater issues there, so it shouldn't be a big issue. Hopefully what David said is true, that the trenches are in good shape and almost like new. I do have a plan. I did find it, David, by the way.
Oh, good.
We had it as 60 Ridgevale Road, and then the system was signed off in 1996.
Okay.
So
yeah,
we do have a design plan on record for that system.
Yeah, and the contractor most definitely will have to dig up the ends of the trench, because there's no as-built information. At a minimum, we need to uncover the end of the trench to get an invert elevation into the trench so that we don't set the septic tank too low.
Correct, yeah.
Quick question, this is John. Would it be customary in a case like this to put a hydraulic load on the trenches and make sure everything's working okay? I mean, put a hose there and run a few hundred gallons of water down through?
I think it would be no different than an installation of a brand new system in that we don't run water down the trenches before we backfill. All we do is check the distribution box to see if the flow is evenly split.
Okay. Hey, I have no reason to think that this trench or trenches are in bad condition. But
The sad thing is sewer's 200 feet away.
Oh,
Yeah, that's the sad part. The town stubbed down Ridgeville Road about 30 feet and stopped. And we'd love to hook into the sewer, but it's cost prohibitive for us to drink water, and that at $100+ a linear foot, it's quite expensive to run that
John,
sewer.
Bob has his hands up. Maybe he
Oh.
can add to this discussion.
go ahead, Bob. Can't hear you yet.
Sorry, I keep forgetting to unmute.
Gotcha.
I just had a simple question because Judy, in your memo, you talk about they're proposing to increase the number of bedrooms to 5, but on the plans, the system design flow is only 3.
Oh, yeah, I'm sorry, that's a typo.
Okay,
Because this is a new house, so it's 3 bedrooms.
yeah, okay.
That's me and my poor editing.
In terms of the sewer, yes, there is a stub on the end of the road there, but right now there's no immediate plans to bring sewer down any further at this point.
Okay. All right, I do see that in Judy's memo of February 24th to the Board of Health members, she does reference the need for 9 conditions. So whomever makes the motion to approve this, should include a reference to those 9 conditions. Any further questions or comments from board members to the applicant? If not, can I get a motion to approve?
This is Noble, a motion to approve with Judy reading the conditions.
Okay, can I get a second?
Second. Sheehan, approve.
Okay, Ed Sheehan, second. Judy, drink some water.
So this is the standard conditions for a secondary treatment unit. The applicant should restrict the property to a maximum of 3 bedrooms and record the restriction on the deed at Barnstable County Registry of Deeds and submit a copy of the executed deed restriction to the Board of Health. Throughout the life of the system, it should be under an operation and maintenance agreement. The O&M agreement shall be for at least 1 year and may be with any mass certified operator of the appropriate grade that has received training by the company on the operation of this system. The effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen shall meet the performance standard of 19 milligrams per liter and shall be collected and analyzed by a certified lab. Water meter readings shall be provided with semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years testing, the application can be made by the board or their agent for review and possible modifications of the monitoring requirements. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and Board of Water and Sewer Commissioners, directs the connection of this property to the municipal sewer when it becomes available. This covenant shall also be recorded at the Barnstable County Registry of Deeds and be copy submitted to the Board of Health. The applicant agrees to apply 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineer's site plan will be allowed without further review by the Board of Health or its agent. And this variance is granted pursuant to the State Environmental Code, Title V, in the Town of Chatham Subsurface Sewage Regulations. It's valid for 1 year from the date the Board of Health approval, and a permit must be issued and work commenced in that 1 year period, or the variance shall expire.
Okay, thank you, Judy. We have a motion, we have a second. We've read into the record the 9 conditions. Any further comments from Board of Health members on this? Anybody from the public wish to comment on this application before the board proceeds to vote? Hearing none, when I call your name, please indicate how you vote on the motion. Dr. Noble Hanson.
Approve.
Ron Broman.
Approve.
Ed Sheehan.
Approve.
Carol Boyce.
Approve.
And I vote to approve, John Beckley. So we have 5 votes to approve, so the variance is approved. Mr. Clark, you're good to go.
Thank you very much.
You're welcome. Let's go to the next item on the agenda, which is our update and a discussion regarding COVID-19 with Dr. Robert Duncanson, Director of Health and Natural Resources.
Good afternoon, members of the board and the listening public. So just quickly, I won't run through a lot of the numbers like we normally do, but keep it a little bit closer to home here on Cape Cod. As of yesterday afternoon, we had 10,088 cases of COVID-19 on the Cape. We surpassed 10,000 over the weekend. Last Friday, we were at 9,955. So over the weekend, unfortunately, we went over 10,000. We currently on Cape, as of yesterday afternoon, have 404 deaths. That was up 1 death from the previous day, and basically up 6 since last Friday, when we were at 398. In Chatham, as of today, we are at 259 cases, and that is up 1 case since Friday. And we have 26 deaths in Chatham, or Chatham residents or people who died in Chatham. The most significant number being those that died at Liberty Commons. So even though they may not have been formally Chatham residents, their place of death is listed as Chatham. And there were no new deaths since last Friday, which obviously is good news. If you remember, we had 106 cases of COVID-19 in January. Thankfully, we only had 41 cases in February. So we are seeing that downward trend since our peaks that occurred starting around mid-December and through the latter part of January, when we had that, spike, if you will, following the Thanksgiving holiday and then the Christmas, New Year's holiday periods and whatnot. We do have a little bit of concern that we might see another small surge after school vacation week, not last week, but the week before that. We'll be 2 weeks from that, the end of this week. So we're kind of, I don't want to say keeping our fingers crossed, but, hoping that we don't see a significant surge in cases because of the school vacation week. We do know a fair number of people traveled, both within the state as well as out of state. So as we all know, that unfortunately increases the chances of having something when we get back. But as I'm sure everybody is aware, the vaccine is rolling out. Cases are down across the country, although the latest information from CDC is that the downward trend is kind of leveled off. And that is of concern, obviously, that we're no longer seeing the downward trend in a national basis that we were seeing, a couple of weeks ago, or even as recently as last week. A couple other things I just wanted to touch base on starting tomorrow. Town offices will be open again by appointment on Tuesdays and Thursdays. Something that we started last fall and then we put on hiatus when the surge started to increase, just to keep our town staff as safe as we possibly could. So starting tomorrow from 1 to 3 and then Thursday from 9 to 11, folks can call up and arrange to make an in-person appointment if they have business, that can't be done over the phone, over the internet, by email, by Dropbox. We still have our Dropboxes here at the annex and at town offices, and over at DPW as well. So we are reinstituting that. We do have a form that anybody coming in for an appointment with town staff will be filling out. Same one we used last fall, asks a series of questions, as well as providing contact information that we then keep on file for a minimum of 30 days in case we have to do any contact tracing, as a result of that appointment. So that starts again tomorrow. And then, as I'm sure everyone is aware, Massachusetts, as of today, is back in phase 3, step 2. We were there last fall, and then as a Commonwealth dropped back to phase 3, step 1 when the surge began. But we are now back at phase 3, step 2. And that, increased capacity up to 50% at a significant number of locations, including indoor performance venues, indoor recreational activities, and then places like close contact personal services, barbershops, nail salons, those kinds of things, fitness centers, libraries, office spaces, and others. And I sent out some information on that both Thursday and Friday of last week. The information that came out on Friday did have some clarifications in it, because the original guidance that came out from DPH indicated that generally employees don't count when you're coming up to that 50% capacity with those limits that took effect today. However, they do count when you're talking office spaces. We don't have any really significant office spaces in Chatham that it really applies to, but just for clarification in case anybody's listening. And then in terms of restaurants, the capacity limits that had been imposed on restaurants in response to the surge was removed as of today. They are still limited to tables being 6 feet apart. So that, by virtue of how much space they have, that is kind of a de facto capacity limit, because tables have to be at least 6 feet apart. The 90-minute time limit on guests in restaurants is still in place. Musical performances are allowed now in restaurants once again, but singing is not allowed indoors, and the playing of brass or wind instruments is discouraged. So, if a restaurant wants to have a singer, it would have to be in an outdoor space. But if they wanted to have somebody with a guitar just playing, that is now allowed once again. And then starting on March 22nd, Massachusetts will be shifting into phase 4, step 1. There will be some modest changes in the gatherings limit for public outdoor events and event venues. So there will be an increase up to 100 persons in an indoor setting and 150 in an outdoor setting. There is no change in private settings. So such as private residences, the limits will remain at 10-person indoors and 25 outdoors. And any other, couple of the other big changes that are coming on the 22nd, as I'm sure everybody has heard, large venues, meaning more than 5,000 capacity, will be able to reopen with 12% capacity. So places like Fenway Park and Gillette Stadium and all will be able to reopen starting March 22nd at 12% capacity. Some of the things that are not going to be reopening as of phase 4, step 1, that I think are important, because we've been getting, some questions about, are we going to have outdoor street festivals and whatnot this summer? Right now, as of the governor's announcement last week, those will not be reopening. So road races, street festivals, parades, and fairs will not be opening on March 22nd as part of step 1 of phase 4. And just, again, something that we've been getting a fair amount of inquiry about with these changes, both today and on the 22nd, there is no change in the mask requirements. Masks are still required indoors and outdoors in all public spaces, and that is not changing, along with the recommendation for social distancing and for washing your hands or using hand sanitizer. And then the other thing that I wanted to just touch base on is vaccine, because I know that continues to be the hot topic of the day in Massachusetts, as well as around the country. I'm sure everybody is aware that the Johnson & Johnson single-dose vaccine received emergency use approval or emergency use authorization from FDA as of yesterday, and they started shipping that vaccine out today. They are shipping out currently several million doses nationwide. As of a governor's press conference earlier today, we don't know exactly how many doses of that J&J vaccine is going to be coming to Massachusetts, or exactly when, but probably sometime this week. And it will be distributed out through all the various channels, the mass vaccination sites, community health centers, and some of the other locations. It's not going to be set aside or directed, if you will, to any one particular location. All the guidance coming out of the state and CDC and everybody is, don't try to play the vaccine game. Don't try to get, just the J&J, because it is a single dose. Please take whatever vaccine you can get an appointment to receive. Whether it's the Pfizer, the Moderna, or the J&J, they are all pretty much equally effective. There's been some talk about the fact that the J&J vaccine, has what appears to be a lower efficiency rate or efficacy rate. But one of the things that's been, people need to keep in mind is it was tested under slightly more rigorous conditions, because it was tested against the South African variant, as well as some of the other variants that the Moderna and Pfizer vaccine were not tested against. So, the guidance is they are all equally effective, and people should really take whatever one they can get as soon as they can get it. I don't have any specific information on the opening of the semi-mass vaccination site here in Cape Cod. We do know that one is coming at 4 Cs, but for the most part for this week, it's going to be primarily second dose vaccines that the county will be giving out to folks that already received their first dose. We don't have any specifics yet on exactly when that semi-mass vaccination site will be opening to the general public. So with that, I think that's all I've got for updates today. Happy to answer any questions.
Questions, comments for Dr. Duncanson?
Well, I have this is Richard Edwards. I have a comment about the decision to reduce the restrictions made by the governor. This appears to be entirely contrary to the advice of the CDC and all the other major scientific experts in this area. It seems to be more of a political decision. At a time when we have about 10 times the number of daily cases of COVID as we did back in April when restrictions were initiated, at a time when new variants are at risk of coming up. If we have a lot more, if we have another surge, it just seems crazy to me to be opening up restaurants, concerts, all these other venues. There's no conceivable way that I can get my mind around why anybody would want to do this. If we could wait 2 or 3 more months until a reasonable number of people were vaccinated and really get the numbers down, we might be able to prevent a lot of a catastrophe going forward. But it seems that the decision's been made, that people have COVID fatigue, and we're just going to open things up and let the chips fall as they may. So I'm wondering if other members of the committee have the same concerns that I do. And then if they do, if there's anything the committee should do in terms of notifying the public that we don't agree that this is a sensible thing to do, or even as the city of Boston, not comply with these state decisions. Do other people agree that this seems premature?
Richard, this is John. I am concerned that I've been reading in the media about CDC being concerned about states doing exactly what Massachusetts is doing. And that has caused some concern on my part. Not enough to the point where I've thought about the possibility of us taking some different action locally, but I do agree that it's raised some concerns in my mind about, well, what does the state of Massachusetts know that I don't know? You know, what data do they have? But I take your point that it is something for us to think about and follow and ask questions about when we feel it appropriate to do so. It would be interesting to see what happens in terms of case counts in the next couple of weeks as states like Massachusetts do begin to relax. Because if it's totally the wrong thing to do, my sense is we're going to see evidence of that in terms of increased case counts. Maybe Dr. Duncanson, you have some comments on that?
You know, I've seen the data that the state's using, as I'm sure you all have, because it's all readily available. I've heard, you know, the guidance, then read the guidance from CDC. You know, I'm not a politician, so I'm not going to comment on that part of it. You know, I think it's a tough place to be. You know, case counts are definitely going down. The governor always said he was using public health metrics to make these decisions. You know, I think we're all concerned that maybe the vaccine rollout, and I don't mean this just in Massachusetts, but across the country, hasn't been as quick as any of us would like. I think things are definitely improving. You know, now that we have the J&J vaccine as well, you know, the infrastructure's in place to get the shots in people's arms. So, you know, it's tough. I mean, you know, based on all the data we're seeing, everything is going in the right direction. That, you know, you could relax some things because, you know, let's face it, this is not just a public health issue. It is also an economic issue, and people like the governor, you know, don't necessarily have the luxury that folks at CDC and others that only need to really look at it from one perspective do. When you're a public official and you're trying to manage two different, sides of the coin, if you will, you have to just make the best decision. I think based on all the metrics, it's not an inappropriate time. I mean, if the governor had said, all right, we're going to go from, 40% up to 100%, that's one thing. We went from 40 to 50%. The mask requirements, the social distancing, and everything else are still in place. So it's not like, we just suddenly opened the floodgates and got rid of all the protections. Clearly we're all going to be watching the public health metrics, and if they start going in the wrong direction, and frankly, even the governor said this, if things start to go south again, these things can be turned back, just like we did last fall. So, I was a little surprised myself, not so much with the governor's announcement for what took place today. Personally, I think maybe the announcement about what was coming on the 22nd was a little premature. I probably would have waited until, a couple of weeks and we saw what happened after today's change before we made a decision. Because I think, unfortunately, now a lot of people are just, under the impression that come March 22nd, we're definitely changing into phase 4. When, if the public health metrics start going the other way, we may not be. And that may cause some angst in the community. And by that, I mean the entire state. So with that, I'll get off my soapbox.
Noble.
Yeah, I had a question for Bob. As far as the restaurant employees and business employees, have they reported any more cases of positive employees? In the last.
Yeah, we recently, as you probably know, I think we talked about it the last time, we did have a case involving Max Seafood, Chatham Fish and Market, where they were closed for a number of days.
Yeah, that was at the last meeting, I think.
That was at the last meeting, and we were made aware just today of an employee at CBI, not in the food service, and the employee had not worked for many days prior to, because, this time of the year, CBI is closed anyway. But this employee had not worked for many days before they tested positive. So there was no concern about 48-hour, look back, because they hadn't worked for, I think it was 5 or 6 days prior to, showing symptoms. So, but those are the only ones that we've been made aware of recently. But, you have to keep in mind a number of the other restaurants in Chatham are closed. The Squire was closed. The other one on Main Street was closed, and some of the others are closed just because of the time of the year anyway.
Richard Edwards.
Yeah, one other question. Do we have any idea what percentage of Cape Cod residents have been vaccinated? And the other thing is about the J&J vaccine. I'm a little concerned that it's only 42% effective in people over the age of 60. Which would make it particularly possibly not a good choice for Cape Cod.
Okay, I'm not aware where you're hearing the 42%. I was hearing numbers in the mid-60s.
It's in their CDC. If you read the CDC application that Johnson & Johnson put in, it gives all the efficacies in different age groups, and it's been published in many places that it's only 42% effective in individuals over the age of 60.
Okay.
Overall, it's 65% in the United States, and it's like 70% in other countries. But 42 over the age of 60 is of some concern, even though people haven't died.
Right.
Yeah, I don't have the percent of folks vaccinated on Cape Cod yet right handy. We could certainly see about getting that number for you.
Yeah, this is Noble. I think the point I've read somewhere about the J&J vaccine is that the rate of hospitalization or deaths is very low, so it may not be as effective in preventing you getting COVID, but the severe cases are basically eliminated, I think, by their
Yeah, it's been reported as 100% effective at prohibiting severe disease and at preventing hospitalizations. That's correct.
And so I just say, just to back up, the mandatory reporting by business in restaurant for positive employees, that's a little bit of an early warning sign for us if cases are starting to creep up along with the other data. So I think that's helpful.
Yes.
All right. Any more questions? I think we've heard some interesting perspectives tonight, and I appreciate the updates as well. I think this is something as Board of Health members we need to keep an eye on. We need to be very attentive and read every opportunity we get in the media about what the latest is. And then I'm sure we'll be re-updating ourselves at our next meeting. Any other final comments or questions regarding COVID-19 before we move the agenda? Okay.
John?
Judy?
Yeah, I just wanted to let the board know, we are working, I don't know if I let you know this last time, that we are working with Outer Cape Health and our locals, our staff, the Council on Aging, Mandy, and Chatham Fire to arrange for COVID vaccinations for our homebound, and that's in the works. Hopefully we're going to get going with that in the week after next, and we're also going to be doing, as I mentioned before, Chatham Housing Authority and Park Place residents, and hopefully in the next 2 weeks. So that is still, we're working on it. It's a complicated thing to arrange to get to the homebound people, but we're going to get there. So I just wanted to let you know we've been working on that.
Good. That's a good update too. All right, if there's no other comments or questions on this topic, let's go ahead and finish tonight's agenda, which is an approval for the February 8th minutes. Everybody received those in their packet. Can I get a motion on the table to approve the minutes for February 8th?
Ed Sheehan will approve.
Okay, can I get a second?
Noble, second.
Does anybody have any edits or corrections or clarifications they'd like to suggest be made in the draft minutes? If not, I'll call the question. When I call your name, please indicate how you vote on approving the minutes of February 8th. Dr. Hanson.
Approve.
Ron Broman.
Absent.
Right. Ed Sheehan.
Yes.
Carol Boyce.
Approve.
And I vote to approve, John Beckley. Okay, so that's it for tonight's agenda. If anybody has anything a minor thing they want to comment on or raise.
John, if I
Please,
can,
Mr.
it's Diane.
Yes, Diane.
There may be a conflict on time coming up for the next month's meeting on April 26th. Planning board meets at 5, so we might want to change it to 2 or 3. If we have a busy agenda, I might move it to 2. If it's not too bad, I think 3 would be good.
Okay.
Just a heads up.
Okay, so you'll let us know well in advance.
Yes,
Okay.
I will. Just wanted to let you know.
Thank you.
Thank you.
Can I get?
John, this
Yes.
is Judy. I just had the one issue that I had mentioned to you on an email today. The Mass Health Officers Association, this is something of personal interest to me, has sent around a request that we contact our local representatives and senators in regards to a bill going through the House that would take public health professionals, health directors, health agents, health inspectors, and move them from reclassify us into a different category for our benefits as far as retirement goes. It would move us into the same categories as police and fire. And it would allow us a little more leeway in being able to retire a couple of years earlier, really. But it's something we've been fighting for several years. And I think that this year being particularly busy and everybody working so hard, they're trying to get it through. So I was going to ask if it would be okay if I put together a letter of support from the board on that. If you're not comfortable making a decision, I can send you the information and the draft letter that was circulated, and you can read it. But it basically just gives the health agents, puts us into a different category for our retirement.
What's the time window on doing this, Judy?
I don't know. They didn't give us any time for when it was going to be voted on.
I'm just wondering whether we can defer it so everybody can get a chance to read through the information.
I think that probably would be fine. We have our next meeting is in 2 weeks, so why don't I can send it around to you and to you all, then you can look at it and put it in your next packet as well.
And we can decide on the next meeting whether we're comfortable with it.
Yeah, sounds
Okay.
good. Thank you.
You're welcome. Okay, let's get a motion to adjourn. Unless everybody wants to stay here.
Noble, motion to adjourn?
Okay, Noble, thank you. Can I get a second to adjourn?
Ed
Ron
Sheehan.
Bowman,
Carol Boyd, second.
Oh, everybody wants to be on the second. Okay, well, let's give it to Ed for the second. When I call your name, please indicate how you vote on whether to adjourn the meeting tonight. Dr. Noble Hanson,
Adjourn?
Ron Broman,
adjourn.
Ed Sheehan. Ed,
He's already adjourned.
Carol Boyce,
Adjourn.
and I vote to adjourn. So we have a quorum, a vote to adjourn. I'm not sure about Ed's vote, but it's certainly
Ed
four.
Sheehan, I'm back again.
Okay, so we have your vote to adjourn, right, Ed?
Right.
We have 5 votes to adjourn. So the meeting is adjourned. Thank you, everyone, for coming tonight.